Next, we have inflammatory diseases of bones. We're going to talk about vertebral osteomyelitis, discospondylitis, spondylosis, and cowder equina syndrome. Yeah, that's another question. Okay, so vertebral osteomyelitis, let's find a picture. Yeah, this is a good MRI, sorry, CT. What is it? It's, okay, let's say what it's caused by. It's usually caused by infection. Sometimes grass seeds can migrate, leading to paraspinal abscesses, which can extend to the spine and cause what we call spondylitis. So upon x-ray, this isn't the same, but it's quite helpful. You'll see increased opacity, so this is very white now, but you'll see a patchy lysis of the vertebral bodies. These are clearly, I think these are the vertebral bodies actually, but they've kind of like broken down. And yeah, then you have discospondylitis. So this is when you have intervertebral discs and adjacent vertebral end plates basically inflaming. So these are going to look larger. See how this has like a very nice, let's say, bow tie shape? This is almost more rectangular and brick shaped, which isn't correct. So yeah, upon x-ray, you'll see irregular end plates and vertebral body shapes. You'll also see the intervertebral disc space collapsing, which is why the arrows are here. They want to show this is how you know it's discospondylitis, not just by looking at the shape, because you can see the views obscured by the ribs and end plate lysis and some subluxation, meaning it will slide out of place sometimes. We'll actually mention it later that discospondylitis sometimes is referred to as like the slipping disc disease, because vertebral discs slip out of place. So because discospondylitis is ending in itis, it means inflammation. So what you get are symptoms like fever, leukocytosis, surprisingly, paresthesia, so different types of like paralysis, although full paralysis is rare, meningitis, possibly if the inflammation extends into the vertebral canals, because inside the vertebral canal you have nerves, which we'll touch on later. Next we have spondylosis. So this is very different to the previous image. This is where you have vertebral joint ankylosis, and it's usually, you can see it's usually in the thoracolumbar region, so the back or behind, dorsal to the lungs. And basically it's when you have fiber disruption between intervertebral discs and vertebral end plates, and you can see in the x-ray that the end plate margin has sort of thickened, and this is because of osseous proliferation, which narrows the intervertebral disc space. So spondylosis actually has the same effects of narrowing this space like discospondylitis, but you can see the effects on the bone are quite different. Next we have cowder equina syndrome. I'm still going to use this picture just because I couldn't find a picture, but basically cowder equina syndrome is referring to the cowder equina. These are nerve roots in the vertebral canal caudal to the termination of the spinal cord. So imagine this goes on and on and on until we get to the tail. At the end here, you have the cowder equina. Cowder because cowder means tail, equina, I don't know what equina means, but yeah, sort of this area. This syndrome is basically caused by degeneration, inflammation, trauma, and cancer, of course, in the lumbosacral region, which is here, so the back/hip area. You'll obviously see pain, but also neural dysfunction, exercise restriction, like they will be quite reluctant to walk. And actually, in larger dogs, one disease that's quite common that I've seen is called lumbosacral disease. So I remember seeing a German Shepherd. The vet I worked with, he would put pressure here on the hip area and the dog would immediately sit down because he was in pain. That's because of cowder equina syndrome, but in this case it was more specifically known as lumbosacral disease because it's here. So yeah, what you'll also see sometimes with this disease as well are degenerative lesions. They're quite common in dogs, and they include the intervertebral disc disease, instability of the lumbosacrum, and even osteoarthritis over time.